Leah, you've talked a lot about fear. And what you know, and I know, and was also in all the research is that stigma and discrimination that people with addiction face due to the disease of addiction, as well as accessing life-saving treatments like methadone that you are on. That is the number one barrier that people face accessing treatment and help at the times where they know that's the good thing for them on on their journeys through recovery and treatment. Can you give me an example first of an interaction that you had with a healthcare provider when you really felt that discrimination due to your disease of addiction or your treatment that you were getting, and that you could really feel that stigma coming up as a barrier between you and taking the next step to get help in that moment?
I would have to go back to the labor and delivery of Luna, because it's just like someone walking in that's full of tattoos. Everybody automatically assumes that they are the worst person until they get to know them, and they're the sweetest person you'll ever meet. When I tell these people, when I told the nurse, I was also part of a GRACE program, which is people that help pregnancy, opioid addiction, and they're social workers, and they work very close with the OBGYN that I attend. Um, but during the time that she was administering the medicine to me that put me and Luna in danger, um, her words to me were, because she gave me more than what I should have gotten. Her words to me were, "Oh, I thought because you were part of the GRACE program," which is where she assumed I got my methadone from, which is not correct, but she assumed. Um, she said, "Well, I just assumed that since you were part of the GRACE program, that maybe you had a higher tolerance." Um, and that is that's horrible. It made me feel horrible because, for one, how can you work in the same two doors down from this program and not know that they don't provide the medication to us at all? They have nothing to do with the medication. They are there for our guidance and our help and and support. And you automatically assumed that because I wasn't feeling what you were telling me, tell me when you start to feel this, and I'll know the medicine's working. And when I didn't say anything to you because I didn't know what I was supposed to be feeling, and I hadn't felt it, and you just continued to give it to me, and then said those words. To say those words after you go through what I went through, immediately after saying, not only did she say, "I assumed that you could, pretty much handle it because you're part of the GRACE program," but when I asked for help, she looked at me um, oh, I just wanted more like I wanted to get more high or something because I was not feeling that feeling that it was supposed to be giving me. Well, no, of course I wasn't, because it wasn't what I wasn't supposed to get it. And then to come back after all of that and then say, "This was a learning experience. We now know not to do that to other patients." That in itself was, I was judged all the way out the door with it. And it sucks. It makes you not want to talk about your addiction and your recovery, and it makes you not want to get help when you really need help.